In this video, I answer a question on why doing yoga helps reduce low back pain significantly, but tends to be worse the day after a session. For those of you who don't know me, my name is Dr. Maggio, and I am a non-surgical expert in chronic pain treatment, specifically for neck, shoulder, hip, and low back pain. My focus is on finding and fixing nerves that become stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in flexibility, functioning, and long-lasting pain relief. All right, so this week's question came from Audrey on Instagram. Let's read it. It says, I'm 29 years old, and I've been working a desk job for the past 5 years, which has led to some pretty significant low back pain that continues to get worse. I've never had any direct injuries to my back. The only thing that helps me is doing a yoga class at the end of my workday, and during and after, it feels so much better. But I've noticed the next morning more pain with sitting and moving around. Why does it feel so good doing the yoga, but worse the next day? Am I doing too much yoga or not enough? Thanks so much for sending that question in, Audrey. And just a quick reminder, if you do have any questions or are looking for answers specifically on neck, shoulder, hip, or low back pain, then send a message to me. And if I think my insights can help, I'll be sure to get a video out to you. All the information to do that is in the profile or wherever you're consuming this video. Let's get into the video. One thing is I'm a very big fan of yoga. I think it is a great practice. I do always recommend not just jumping into a yoga class, maybe investing in a couple private sessions to learn how to do things better. But I really wanted to address this question for Audrey because it's pretty common and I get this a lot. So first, let's just talk about what starts to cause a low back pain. Audrey said here, and a lot of the clients in the cases that I see in my own practice, they come in without any really direct injury or trauma to the low back. And they're kind of like, how did I get this problem? I never had an accident or a fall or anything like that. Where did this come from? It kind of comes out of nowhere. So essentially what happens is sitting is really bad. A lot of people joke around and they say, sitting is the new smoking. I'm starting to believe that more and more from what I see. So basically what happens is we spend a lot of our time sitting, we have desk jobs. We're not moving like we should. As humans, we're supposed to be up and moving around, and we're not moving around. We're supposed to be laying down, but that's not how society builds us up. So over time, what happens is when we sit too much, it puts a lot of stress on the low back muscles and the ligaments itself. And this stuff called adhesion, I talk about it all the time. It's like a glue that gets inside the muscle. It's also known as scar tissue. So when you're sitting, the muscles are contracting, they're pulling tight, they're not really getting a break. And what happens is they don't get enough blood flow. They don't get enough oxygen. So it sends a signal to the brain. The brain goes, hey, what's going on? There must be an injury there. So it starts to send down these fibers that are like called collagen fibers, and they're not like fully developed yet. And then they get inside the muscles and the ligaments as well. And the first thing it does is it makes the area less flexible, and then it makes it weaker. So the first area where I get low back pain without any direct trauma, a lot of times is in this ligament here. It's called the supraspinous ligament. It basically goes from the tip of a bone called your sacrum and runs all the way up to the top of your lumbar spine. Now, when you're sitting, this ligament is constantly getting stretched. When it gets stretched, that's where that blood flow and oxygen comes in, doesn't get enough. That's where that adhesion comes in. But what happens over time is there's not a lot of what's called pain receptors in this area. So you really don't notice it. Sometimes people might just have a little bit of stiffness, a little bit of soreness, but once they move, it feels a little bit better. Then what happens is this ligament kind of sets the tone for how the whole spine is supposed to move. And now the ligament can't move how it's supposed to. So now it causes the muscles around there to start to have to work harder. And when the muscles start to work harder, they then develop more and more of that adhesion. Now the muscles become less flexible, they become weak. Now the pain might be a little more intense. It might be a little bit more sore. You might notice it a little bit more, but not enough where it's like you want to do something about it. You're just like, my back's a little stiff. If I stretch it or go to yoga, it feels okay, not too bad. Then what happens over time is that adhesion gets bigger and bigger and starts to spread out. And eventually it gets stuck to the nerve. And the most common nerve that it gets caught to is the nerves in the spine and then into the sciatic nerve as well. And it creates what's called a nerve entrapment. Now, when nerve entrapments happen, you get some numbness, some aching, some burning, some tension. What else starts to happen when you have a nerve entrapment is all the muscles around there tighten up to protect that area because the body doesn't want the nervous system to be compromised. So it tightens a lot of things up. So a lot of people have like more soreness, more tightness. They might even get like some back spasms and some muscles called the QLs. And a lot of times people think the QLs are what is actually causing the problem, but those are just protecting to take the pressure off of the nerve, unload it. Maybe the pelvis will shift forward, the hip will go higher, the hamstrings will tighten up. All of that is trying to get the pressure off of the nerve. Bad enough. Then eventually, when the really bad problem comes, is when it puts pressure on the discs and the joints in the back. This is when you get those really bad days where everything hurts, wake up stiff, can barely move because the ligaments, the muscles, and the nerves, they have to kind of provide some stability and support the discs and the joints, but they can't. So now what happens is it puts more wear and tear on the discs and joints. You start getting things like disc bulges, disc herniations, protrusions, all sorts of things. And that's when things really start feeling bad. That's when you get those really bad days, that 8 out of 9 or 10 pain. Now, when you're doing yoga, and what's happening with Audrey here, and this happens with a lot of people, is when you're actually doing the actual yoga, there's this pathway in the spinal cord. It's kind of fancy. It's called the lateral spinal thalamic tract. Let's just call it the LSTT for short. And there's two types of sensations that move up the spine there. One is pain, and the other one is vibration and movement. What happens is when you're doing the yoga, you're doing a stretch, maybe you get a massage, you get an adjustment, you really stimulate some of those mechanoreceptors and they start firing and they kind of block that pain. So temporarily, you do feel better because that pain isn't there. It's kind of like when you jam your thumb in the door, you kind of shake it out to block the pain. That's what's happening there as well. So this is why she feels good when she does the yoga and she feels better right after it. But then the next day, she's really beat up. And what's happening is that disc was actually getting loaded even more because some of that protective tension in there was supposed to help can no longer help anymore. And then the disc really gets beat up. And then when the disc is getting beat up, getting damaged, getting jammed up, it lays down a lot of inflammation, which is why she feels worse the next day after the yoga. So the problem with the yoga is it's temporarily making it feel better, but it didn't actually fix any problem. It's kind of like your check engine light comes on in your car. You turn it off, but you don't fix anything. You're gonna have to deal with that problem down the road. So what to do to actually get this problem fixed and get it better? First is just get all that adhesion in the ligaments, in the muscles, and the nerves treated by one of our providers. What we're able to do is get in there very precise, very focused with our hands and the use of an instrument. And over a series of visits, we actually break down that adhesion, which makes the muscles healthier, stronger, more flexible, and they start functioning better and things are moving better. Then that's where yoga really comes in because now once that tissue's healthy, you can start to build some of that strength up. Because when you first get the adhesion in there, it makes everything less flexible, but it also makes it weaker. So when we get rid of all that adhesion, now we have this window to go in there and actually strengthen the tissue. Now, yoga is really good at keeping things moving in the right direction. What I find a lot of times with a lot of people, my clients and patients that do a lot of yoga, they actually don't like to do a lot of strength training, but strength training is really important too. And I recommend doing that like 2 times per week. Like do some yoga a couple times a week and then do some strength training a couple times a week and really get in there and build up what's called the posterior chain, which is going to be your hamstrings, your glutes, and things like that. That's going to make that tissue healthier, make the low back stronger, more resilient. Because what I usually find is that people either do too much strength training and not enough mobility, or they do too much mobility and very little strength training. You kind of need both as you go. So, hope my answer helped. If you're dealing with any issues, you need some help with some back pain, some neck pain, shoulder pain, hip pain, you haven't got any real answers, you're tired of getting the runaround by all these doctors and so-called experts that aren't helping you at all, reach out to us, request a no-charge consultation from one of our awesome Peak Method trained providers, and finally get on the path to feeling and functioning a heck of a lot better and get some long-lasting pain relief. I appreciate you watching, and I'll catch you in the next one. Bye.